Interesting. Can you talk about a few natural cancer treatments other than what you already listed? Any other natural cancer treatments that you're aware of that are effective?
Well, the first is really to ask the patient why he or she wants to live. And it's shocking, Ty. I think probably at least over 50% of my male clients, let me say my former patients, 60% of the males, once the wife is out of the room, they say to me something like, look, doc, with all due respect, I really don't want to live anymore. I certainly don't want to bankrupt my family. I've had a great life. Everything is good. I don't want to be a burden. You know, I'm done. I'm only here because my wife wants me to be here. I respect that because these are guys who know from friends and so forth that the next 5 years of conventional cancer treatment is going to be a debacle. They don't want to go through that. So my first job is to try to get them inspired. If they could see a way through where we could focus on helping their body be healthy, would they buy in? But I have to tell you, most patients have given up by the time they see an oncologist. They don't believe they're going to do well. They don't think it's possible, and they know they can't afford it, and they're dreading it. So if the oncologist doesn't put on a psychiatrist hat and say, how are you feeling about this, Mr. Jones? Or what would you like to do, Mrs. Jones? And not get those thoughts and ideas out on the table, then you're just wasting time. So the first treatment really is to have a relationship with the patient where they can really share their concerns. And then you can say, you know, I'm not God, I can do my best, you know, what are the criteria? You don't want pain or this or that, and you can formulate something. But I have to tell you, it is shocking what oncologists get away with when they simply lay out a plan and they don't really listen to no's and they say the patient has no choice. You know it's even worse with parents with their kids with cancer. So the first treatment is really to have a relationship and try to learn what the patient wants. Now, in the current way that medicine's practiced in America, nobody has time for that kind of a discussion, but it's critically important. The second thing is I'll ask my patients, you know, why do they think they have cancer? And a lot of them will say, I don't know. So I say, well, why do you think you have cancer? And they say, well, I don't know. And I say, well, why do you think you have cancer? And they know I'm not going to stop until they tell me. And it could be that they feel like they've sinned, or they could have some guilt or something. So then if one doesn't exorcise, so to speak, that, and help them understand that whatever they've screwed up in the past, their main commitment is what they can do today and going forward. Again, the best chemo drugs in the world aren't going to be helpful. You have to have people understand that it's their life and help them feel empowered. And you and I can appreciate the word enthusiasm means God within, and theos. So if the patient can't be enthusiastic about each day, then that's a big immune drain as well. It's not about prolonging life and suffering. It's about quality of life. You want to prolong quality and quantity. But I would encourage my medical colleagues, my oncologists, to have those types of discussions with the patients. I just think it's critically important. And then we deliver smart therapies.